Multiple choice was 10 questions, and I think most students probably need to work a little bit harder at and practicing multiple choice questions. Just some tips with regard to the multiple choice. Allow the time that's allocated. A lot of you will try to rush through and make up time in the multiple choice to use later in the exam, but use the allocated time. It recommends that you use around 20 minutes for this part. The other major tip is to make sure that you read the questions effectively and thoroughly. The questions are designed for you to choose the most correct answer. So there may be questions that have answers that you could, and hopefully they are created this way, that there are elements that are correct in a number of the different alternatives. So take your time, there will be a most correct answer. Quickly for question 1, physical activity guidelines for Australians, which is not a physical activity guideline for Australians, exercise at 40% of the maximum heart rate. This question relates to developing personal skills and looking at ways in which individuals can develop their personal skills to develop health. The amount of alcohol, how many grams are of alcohol in a standard drink? The answer is A, 10. Again, this question relates to the development of personal health practices which will improve health. So 10 grams for the number of grams of alcohol in a standard drink. Question 3, the Ottawa Charter was held in Ottawa in 1986. The answer is C. The other years there may have been significant in terms of other types of conferences that were held by the World Health Organization, but 1986 is when the Ottawa Charter was held. Question 4, which of the following is true of health initiatives that reflect the new public health approach? The new public health approach, the answer is D. The new public health approach looked at taking blame away from individuals. It also recognised that there are social factors and things outside of the individual's control that will impact on a person's health. Question 5, which cause of female mortality is increasing in incidence and has tobacco as a major determinant? Some of those other alternatives may have been increasing, but the tobacco as a determinant is heart disease. So determinant therefore for those is heart disease. Lung cancer is the other major one that may have confused people having tobacco as a determinant, but is actually decreasing. Question 6, which drug is responsible for the largest number of deaths within Australia? That is tobacco. It's high correlation between cancerous diseases plus cardiovascular diseases. Alcohol is another major one. Those are the two major ones. Heroin and ecstasy, despite them being illegal and having major health issues associated with them, they don't actually cause as many deaths within Australia as the other two, and tobacco is the highest. So the answer is B for question 6. Question 7, one leading Sydney hospital recently allocated greater resources to counselling services. This is an example of which Ottawa Charter action area? The answer is B. Through the introduction of counselling services, that shows a community spirit, which then allows people to access parts of that community, which would be services that would assist in the development of skills for the individual who's accessing those services. Option D is not an action area of the Ottawa Charter, and the other two areas don't fit the option as well. So building public healthy policy is to do with laws and regulations that would exist in our community that isn't related to this particular option, and creating supportive environments could be the other one that people could argue. However, the most correct answer is B, strengthening community action. Question 8. Which of the following is the most effective way of managing morbidity and mortality in Australia? Through the development of public health approaches, it's been found that the primary prevention of healthcare, option D, is the best way for us to deal with morbidity and mortality, death and illness in our society in Australia. So primary prevention means it happens before the event of someone becoming sick or dying. That's the most effective in terms of allowing people to live longer lives, living healthier lives, and the cost to society. Question 9. Anthony weighs 100 kilograms and is 200 centimetres tall. He's very big and very tall. He would have a body mass index of 25. BMI is calculated by weight over height squared, so weight in kilograms over height squared. That gives you a mathematical answer of 25, which in relation to question 10 for relation to Anthony in question 9, body mass index would be considered overweight. He would not be considered obese, but he would fall into the overweight range. So the answer there is C. Thank you.